So good afternoon. I'm Joanne Conroy. I'm the President and CEO of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health. And I'm here with Dr. Mark Creager, who's the head of our Heart and Vascular Center here. We are celebrating Women's Heart Month, and it's our Go Red for Women luncheon this month. But also it is, tomorrow is Valentine's Day, so it's appropriate for us to actually talk about both issues. Mark, tell us a little bit about how long you've been here, and maybe share with us some things that maybe surprised you about the Upper Valley.
Okay. Well, first of all, good day, everyone. I've been at Dartmouth-Hitchcock for 3.5 years, coming as the director of the Heart and Vascular Center. Prior to that, I was in Boston at Brigham and Women's Hospital for 31 years, where I was a cardiovascular physician and researcher, and ran the vascular center there. Those of you who are familiar with the Upper Valley would see why I'm so excited to be here. It's a beautiful place to live, and Dartmouth-Hitchcock Medical Center is a great place to work. The people are absolutely passionate about what they do, taking care of patients. And the work ethic here, the personalities, the commitment is really all come together through one absolutely terrific environment. And it translates into how well the patients perceive their care, and importantly, I'm just so happy to have realized that the outcomes we're getting here are as good as anywhere.
No, you're right, you're right. There is something unique about the Upper Valley as well in terms of the rural nature. When you were living outside of Boston, and I know you live in Lyme, so if you had to drive 15 miles, you probably passed maybe 750,000 people. And when you drive 15 miles here, you probably pass maybe 1,000. So that does actually create some challenges, especially when we talk about cardiovascular care and continuity of care. Did any of that surprise you when you got to Dartmouth-Hitchcock, how rural it was?
Well, actually, the commute was welcome, because driving up the Southeast Expressway in Boston was stop and go, and here I almost go the same distance and barely stop at all. In fact, rush hour, I might have to wait one light cycle.
Yeah.
But you're right. The issue here is the rural nature of the population we serve. And that's really important because given how far everyone is dispersed from population centers and even from us here, it really limits their ability to access good health care and do it in a timely manner. And as a consequence of that, by the time many people show up here for their care, the horses proverbially left the barn. They've already been afflicted by a number of problems that lead to, in the type of patients I take care of, severe heart and vascular disease that potentially could have been avoided if they had sought attention for health care sooner.
And I've heard of some scenarios that are probably particular to this area from some of your cardiologists, people that are hiking some of the mountains around here that are having heart attacks while they're hiking and have to be airlifted here. And a lot of wonderful stories about really quick interventions that actually have incredibly positive outcomes.
Right, and that's one of the beauties of this place, the systems of care that have been set up to take care of these patients. So one system of care, for example, is how we manage heart attacks. And it's very important if someone is having a heart attack that they get to a place like ours, a medical center like ours, where we can do very quick intervention. A heart attack often occurs if there's a blockage in an artery that is feeding the heart muscle. You want to get that blockage open as soon as possible. So the system of care that is set up in our rural environment really permits that to happen in a very rapid manner. So it begins with the call to 911, the emergency personnel getting there, diagnosing the heart attack, forwarding the information ultimately to us, and we arranging for them to get here, if necessary by helicopter or by ambulance, as quick as possible, so we can get them to our cardiac catheterization laboratory and open up that blockage as quickly as possible.
So I have a few questions about that, but I also want to remind our viewers that if you have specific questions you want Dr. Creager to answer, please put them in our Facebook Live feed. And again, we're interested in all your questions about cardiovascular care, but also cardiovascular care for women, since this is Women's Heart Health Month. So let's talk a little bit more about how you get information from the ambulance or from the helicopter. Can they actually send the EKG or the heart
Right.
tracing as well as all the vital signs, or does it all have to be over the phone?
No, well, the EKG is something you can transmit because you have to look at. Other information can be transmitted verbally, and whether it's to a local hospital if the patient has to stop there first, which is often the case, and then they send the information on to us, or directly from the ambulance. Either can take place depending on the situation.
You know, there's been a lot of interest in wearables that actually, as you're going, oh, they're often touted that they can do more than they can really do. How about the things that people buy in the marketplace, and might be the Apple Watch or any other number of wearables that are supposed to do your heart rate and your blood pressure, et cetera?
Well, enabling individuals to take more and more responsibility for their health is a very positive outcome of a lot of the new technology, including the wearables. So even something like blood pressure, which I'm hoping we'll talk about in greater detail later, being able to monitor your blood pressure at home is really important in getting it under control and communicating with your healthcare provider. But other things that are now available, the newer Apple Watches can detect rhythm disturbances, an irregular heart rhythm called atrial fibrillation or AFib. And that helps people who are at least have had a diagnosis of atrial fibrillation keep an eye on their own heart rhythm. So in many respects it's good, but we're still learning how to best manage that, how to prevent people from getting too nervous about what they're observing versus appropriately using the information and conversing with their clinician.
Yeah. So let's talk a little bit about taking your blood pressure at home. You know, my dad had high blood pressure, and my mom used to take his blood pressure twice a day, in the morning and the evening, exactly the same time. They had this routine. And, you know, they did it for 70 years. So how should people, if they have high blood pressure, approach maybe monitoring their own blood pressure? Because a lot of people are afraid of the devices and are not sure they can use them correctly.
So high blood pressure is, first of all, it's a really important problem in the United States. Do you know that in our country, over a third of the adult population has high blood pressure, and the prevalence increases as we age. So if you're over the age of 65, or the majority of people over the age of 65 probably have high blood pressure. And why is that so important? It's important because high blood pressure can lead to other problems. It can lead to heart attacks, it can lead to strokes, congestive heart failure, kidney disease. So we need to know it's there, and we need to manage it properly, because proper management, getting the blood pressure down to normal levels, significantly reduces the risk of all those bad outcomes.
What is a normal level?
So our most recent American Heart Association, American College of Cardiology guidelines define a normal blood pressure now as 120/80. So many of the audience are thinking, wait a minute, what happened to 140/90?
Yeah.
Well, just to begin, it's not that blood pressure is fine and then you hit a cliff and fall off it at 140/90. As the blood pressure increases from 120/80 and higher, the risk of some of these bad outcomes that I spoke about, whether it's heart failure or stroke, increases. So the new definition of a normal blood pressure is 120/80. That doesn't mean that you need to be on all these medicines to get yourself down to 120/80, but our new guidelines do indicate that for people who have blood pressures of 130/80 or higher and are at high risk for cardiovascular disease or high cardiovascular disease, they should be treated to get it lower than that. So that's important. So to get back to your original question, which I didn't address yet, which is what about these home blood pressure devices? And again, going back to these new guidelines, managing blood pressure is a partnership. It's a partnership between the healthcare provider and the patient. So managing blood pressure does not mean you only get your blood pressure checked when you go into the physician's office, whether that's every 6 months or once a year or whenever, and then you don't deal with it other than that. In fact, that's probably the worst thing you can do, because when we go to a physician's office, our blood pressures are generally higher than normal. There's anxiety associated with that. So what I advise and what the guidelines recommend is that we use home blood pressure monitoring as an adjunctive, an additional way of monitoring one's blood pressure, and then with that information, really having a conversation with the healthcare provider, conveying what the blood pressure is, so that treatments can be modified to optimize blood pressure control while the patient's at home.
So your blood pressure changes though during the day. I noticed that if I have 2 or 3 cups of coffee, my blood pressure is going to be a little bit higher than if I took it before I had that coffee. How should people react to that?
Well, so blood pressure, change in blood pressure is a normal response that we all have. It's appropriate. There's sometimes you need your blood pressure to be high. If we go back to prehistoric days and you're being chased by these saber-toothed tiger, yeah, whatever. You know, you want your heart rate to accelerate and your blood pressure to go up because you need that to, you know, depart from that situation as quickly as possible. So typical things like exercise appropriately will increase one's blood pressure. That's nothing to worry about. Stress, unfortunately, also will increase one's blood pressure. So if there is some stress going on in one's life, and they're thinking about it or exposed to it, that's going to increase somebody's blood pressure during that period of time. Some food substances, as you spoke about, may increase blood pressure. Caffeine, for example. That's why you don't want to have your doctor take your blood pressure as soon as right after you've just had a cup of coffee. So these transient things will happen, but it's really what the average blood pressure is during the day that really determines what one's risk is for an outcome. So, you know, you can affect your blood pressure not by acute changes. I mean, the chronic changes in blood pressure can be affected by what one does at home. So people who exercise, for example, tend to have lower blood pressure in general than people who do not. Conversely, people who consume a diet that's very high in salt, their blood pressure is going to go up versus those who do not.
So I want to remind the people that are watching us now that you can send in questions by just going on the Facebook feed and submitting a question. We're monitoring that, and then we'll answer it for you. Really, all questions are game about heart health or women's heart health. Now, February is Heart Health Month, and it gives us an opportunity to shine the light on heart disease. And actually, in my Joanne's Journal today, I identify a lot of famous women that actually have had heart attacks or had to have their valve replaced. I know that you're past president of the American Heart Association, so you know a lot about raising awareness around heart disease every February. So talk a little bit about why we have Heart Health Month and the Go Red for Women campaign, because I'm sure that was a big part of your role as president of the American Heart Association.
Well, first, a historical perspective. It was actually back in 1964, at the encouragement of the American Heart Association, that Congress requested that the president proclaim each February as American Heart Month.
Oh, wow.
So this has been going on for
a long time.
A long time. And that's important because it serves as a reminder to all of us that we need to think about our heart health and take those steps necessary to prevent the consequences of heart and vascular disease.
Isn't it the largest or the most significant cause of death?
Yes, it is. Unfortunately, over 840,000 people in the United States die each year from cardiovascular disease, heart disease. That's about 2,700 deaths per day, or of all deaths, 1 out of 3 are caused by heart disease. And that is the #1 killer in the United States, far exceeding anything else. Yes. So it serves as a reminder to us. Now, the good news is, over the past decade, with efforts by organizations such as the American Heart Association, getting out to the public, supporting important research, and making sure that that research is ultimately translated to the public, putting guidelines together to help clinicians take care of patients, the death rate from heart disease has fallen. It's fallen about 30% over the past decade or so. Although recently, and I'll tell you why in a minute, it's starting to flatten out. But you know, these are important things, but it's still up there. It still claims the #1 spot. So there's a lot of work to do. There's a lot of work to do in identifying people who have risk for heart disease and helping those individuals take those steps necessary to lower their risk so they don't suffer the consequences of a heart attack.
You know,
or
a lot
heart
of the
failure, yeah.
famous women that have had heart attacks, it's interesting. I think Rosie O'Donnell, who openly talks about her heart attack, she waited for almost a day and a half before she sought care.
Right.
And it's either not being aware or maybe some internal denial about the symptoms.
Well, it's that and more. First of all, for many, many years, women thought that they were not subject to heart disease. That's just wrong. In fact, women are affected by heart disease just as much as men are. That death rate I spoke about, well, half of the people who die are women. So it's a very real problem in women as it is in men. So importantly, we need to raise awareness. First, let women know you are subject to this. Women are the care providers, right? They take care of everybody else, but they also need to take care of themselves as well. So one of the problems is that for things such as heart attack, the symptoms in women are not always the same as in men, and what we're traditionally talk about, that severe chest pressure,
Right.
that warning sign for a heart attack. Now, women get that too, but they may have other symptoms. It may present as shortness of breath, or nausea, or lightheadedness, or something that's very unusual,
Yeah.
unusual for them. So women who are having a new symptom, not something they've been experiencing, but something new that is causing them anxiety, that they know something's not right, don't ignore it.
That's
Yeah.
good advice. I think I remember that women do have some unusual pain sometimes. So it goes to the jaw, or goes
Right.
to the shoulder, or goes to the back.
Exactly.
And they think that they pulled a muscle rather than they're having a heart attack.
Right, and that is not uncommon. So you're absolutely right. The chest discomfort may radiate up to the neck or to the shoulder. It can do that in men, but it may be more in women, or just occur in the neck or jaw and shoulder. And it's not musculoskeletal pain necessarily.
Yeah.
So one should not assume that it is. And even here in the past several weeks, I've seen several women who showed up late, who were having a heart attack. By showing up late, they didn't come in a timely enough manner for us to intervene.
Yeah.
Time is heart muscle.
It's heart muscle.
Yeah.
Yeah.
So women really do need to be aware of the fact that, one, they're at risk for heart disease, particularly if they smoke, particularly if they have high blood pressure, particularly if they have diabetes, particularly if they have a family history of heart disease. But in any case, they're still subject to heart disease just as men are. And if they have any symptoms that's untoward, that they're concerned about, it's always better to seek help, go to the hospital, make sure you're okay, but if you're not, you're at least in a place that you can be taken care of.
Now, we do have a question from our audience. We actually have a couple. Are there good scientific studies that support that saturated fat in milk and eggs are actually good for you, including for heart health?
Okay, I would say that there are not good studies at all that say that they're good for you. We recently published a paper, the American Heart Association published a scientific statement of which I'm a co-author, talking about the adverse effects of saturated fatty acids. There's been studies that have been published over years that would support that notion. It does remain controversial, whether you can have an egg or two a day, and is that bad or is it okay? And I'm not going to deny someone the opportunity to have an egg once in a while. But if someone is just being excessive in using saturated fats, or a diet that's high in cholesterol or high in sugar, those things are more likely to cause problems in the heart than if you had a proper diet. So a heart-healthy diet is really one that's low in cholesterol, it's low in saturated fatty acid, it's low in salt, it's rich in nuts and whole grains. It has non-fat dairy, things of that nature. And I would adhere to that. I do adhere to that. So I don't recommend to my patients something I don't recommend to myself.
Yeah, got it. There's another part of the question. What about plant-based diets with regard to heart health? You know, there are a lot of diets around that say don't eat anything that wasn't here 100 years ago, or you know, eat all the protein you want with the high protein, low carb diet. So this is plant-based diet.
Well, diets that are, again, low in saturated fat and cholesterol and low in sugar are good. If a plant-based diet has those characteristics, that's fine. If someone prefers being a vegetarian or a vegan, and that's what they want to do for their lifestyle, that's fine. And I think that those who do that generally have lower levels of cholesterol, more ideal body weight, and lower blood sugar, and as a consequence of that will probably be at less risk for bad outcomes.
Yeah. Another question from the audience. What are the signs of sustained tachycardia, and when should I be concerned? You know, this is an interesting question because a husband of a friend of mine just had sustained tachycardia of 170 beats a minute, you know, before an upper endoscopy when he's had that before. So yeah, this is an important question.
So first of all, tachycardia means fast heart rate. Right? Cardia is heart, and tachy means fast. So normally our heart rates range between 60 and 100. They may go higher than that if we're exercising. But if someone suddenly has a heart rate that's faster than 100, certainly 150, 170, that's tachycardia. There's different causes of tachycardia depending on which chamber of the heart it originates in. So the first thing is it should be evaluated. Now, how does someone know that one has it? Well, you might feel it. You might feel your heart.
You might feel bad.
You could feel lousy. You might actually feel your heart feels like it's racing out of your chest, but some people don't feel it at all, and it's picked up almost by serendipity when someone takes their heart rate. But depending on what the cause is, there's different treatments. But in any case, it should get checked out because there's those that are annoying but not life-threatening. But there are others, such as atrial fibrillation, which can be very fast, which can actually cause a clot to form inside one of the heart chambers and leave it and cause a stroke. You want to know about that and get it treated. And then there's forms of tachycardia that originate from the lower chambers of the heart, the ventricles. They can be life-threatening. So until you really know what it is, it should be checked out by a qualified clinician.
But anything over sustained heart rate over 100?
I would be concerned because even by sustained, if you mean it's there all day long, well, there are diseases that cause that. One of them is high thyroid levels. That may be the first manifestation of hyperthyroidism, high thyroid levels. Severe anemia can cause that. Someone whose blood oxygen levels are not high enough, maybe because they have severe lung disease, that can cause the heart rate to be up. Fevers can too. So it really depends on what the heart rhythm is that's causing that tachycardia. And then again, you need to get it checked out because a good clinician can help figure out what's causing it, what it is, and what's causing it to initiate the appropriate treatment.
Now, we talk a lot about Heart Health Month in February, but you do events year-round to actually focus people on cardiovascular health. What are some of the other things that your center sponsors?
Well, we can't ignore heart health 11 months of the year. So this, February gives us a chance to really get out there and speak about it, and really all over the country people are speaking about it, but we continue to speak about it here and elsewhere, particularly with the public, to remind them of what heart disease is, but importantly, to talk to them about the risk factors that contribute to heart disease and what steps they need to take to prevent that. So just last week here at Dartmouth-Hitchcock, we had a symposium. It was on a Saturday. It went all day. It was called Get Heart Smart. And we really had a terrific audience that came in and listened to presentations by our faculty about things such as blood pressure, such as cholesterol, such as atrial fibrillation, such as heart failure. Really to inform them about what many of these things are, how they can help recognize it, and what steps they can do to take care of it. But we're actually not just going to limit those types of interactions to one day, once a year. We will be going out and speaking at communities throughout New Hampshire as well as Vermont over time doing a symposium, maybe shorter symposiums in the evening, to talk about these topics with the people. I feel, as all of my colleagues do, we need to go where the people are. We just can't sit here and wait for them to come. So if we can get out there and convey important information to them, that may really put them on the road to better heart health.
So as we wrap up, this is Valentine's Day tomorrow, and what a great way to actually care about somebody you love, to really, although my husband doesn't want me to talk about his blood pressure tomorrow. He probably just wants a steak with a lot of salt on it, but you can close your ears.
I'll talk to him.
What are you doing for Valentine's Day? And your wife can actually turn off the sound on her
Well, she may
computer.
be watching. She may be watching. Well, as my wife knows, I love her dearly, and I have arranged for her to receive a bouquet of roses as a reminder of that love, as a reminder of Valentine's Day, and really how important we are as a couple, how important it is that our hearts are really locked together.
Yeah, well, that's great. That's great. So this Valentine's Day tomorrow, reach out to somebody that you maybe haven't connected to in a long time. We know that loneliness is actually is associated with people not living longer, and certainly not living the quality of life that they would like. Maybe reach out to somebody in your family you haven't connected with in a while, and also remember to reach out to somebody you really care about and thank them for being your partner in life. So with that, thank you very much, Dr. Creager.
Well, thank you, Dr. Conroy.
Appreciate your time. And that's it for our Facebook Live.